can see there's somebody in front of me, but I can't say, I wouldn't tell whether you are a lady or a man, but I hear the voice through experience and the color of the clothes, like I have to be helped to dress up. I can see this hand, but I know that I've stretched my fingers, but I don't see them. I don't see them, so I would advise people really to go and check their eyes, maybe annually.
My symptom starts when I wake up, like I'll have a slight headache, and then afterwards my vision will start getting blurry. And then throughout the day it will just keep on getting worse and worse, and then I can't see, I can't read.
Are you having headaches around your eyes? If you find yourself rubbing your eyes more often or holding things closer or far away from your face as possible so that they can be seen clearly, then it might be time for you to go see your doctor. Hello and welcome. I'm your host, Dr. Mosam Tombeni, and signing with us today is Aisha Ramjaganath, as well as feeder interpreter Nomsa Matebula. On Vital Signs, we focus on glaucoma. World Glaucoma Week is commemorated from the 6th to the 12th of March each year to raise public awareness and to highlight the importance of early detection and slowing the progression of glaucoma, and that regular eye tests are the only way to detect symptomless glaucoma early. At a late stage, glaucoma is irreversible and results in sight loss as well as blindness. Coming up on the program, we'll look at inserts produced by Zamabu Telezi. She spoke to two men about their journey with glaucoma, and we speak to consultant ophthalmologist who's the head of the glaucoma unit at St. John's Eye Hospital in Soweto. We'll also speak to ophthalmologists and optometrists about glaucoma. Remember that you can be a part of the show by asking the guests that we have on the show any questions that you have on your mind, or simply share your view with us on what we're discussing. The number to call is 011-714-5861 or 011-714-5877. You can also share your thoughts with us on social media. On Twitter, it's at SABC Vital Signs, and on Facebook, SABC Vital Signs. The show continues right after this ad break. Stay with us. Welcome back to Vital Signs. Now, glaucoma is a disease of the optic nerve characterized by the loss of vision field and usually asymptomatic, making early detection and treatment difficult. Now, this illness is the second most common cause of blindness in our country. Nevertheless, with the available treatments, in most cases, the illness can be controlled. Brian Saul from Johannesburg spoke to Zamabu Telezi about his journey with glaucoma diagnosis and the impact that it's had.
Byron Saul from Johannesburg, who is a patient at St. John's Eye Hospital in Soweto, describes to us the symptoms that led to him being diagnosed with glaucoma.
So the symptoms actually comes in like a wave. First, when I wake up, my symptom starts when I wake up, like I'll have a slight headache, and then afterwards my vision will start getting blurry. And then throughout the day, it will just keep on getting worse and worse. And then I can't see, I can't read. It's difficult for me to like take a drive, maybe to the shop or something.
Was there history of glaucoma in the Saul family?
Not glaucoma, so to say. I have a history of uveitis, which is part of the glaucoma family, so to say.
How did Saul receive the news of his diagnosis, and how did this eye illness impact his life?
It's actually quite challenging, me being a young person as I am, because as you know, young people always like to go out, we always like to do activities and stuff, so it's kind of puts me at a disadvantage or a stumbling block that I need to get over every single day of my life.
Saul took us through his long treatment journey.
The first surgery I had was last year, March. After the surgery, the doctor gave me a whole bunch of medication like eye drops, pain numbing medication, and the second one, not as much because I've had the previous surgery, so I already knew what to do, how to use the medication.
Saul shares his views on early screening for one's eye health and vision based on his experience with glaucoma.
When you start getting problems or when you start experiencing problems with your eyes, get it checked out immediately. But if you are diagnosed with glaucoma, it's not a death sentence. It just makes your life a little bit more interesting.
After the ad break, we speak to optometrist Audience Maluleka and ophthalmologist Dr. Tebogo Maleka about glaucoma. Stay with us. Welcome back to Vital Signs. Now, World Glaucoma Week is a joint initiative between the World Glaucoma Association and the World Glaucoma Patient Association, and has had a successful run over the past 10 years of World Glaucoma Week, which is commemorated to raise awareness for the silent robber of vision. Now, glaucoma is the first cause of reversible blindness worldwide, and moreover, for every case that is diagnosed and controlled, there is a person walking down the street who doesn't know that he or she has glaucoma. Francesca Andeveri, consultant ophthalmologist and head of the glaucoma unit at St. John's Eye Hospital in Soweto, speaks to Zama Buteleze about World Glaucoma Week.
Consultant ophthalmologist and head of glaucoma unit at St. John's Eye Hospital, Dr. Francesca Andeveri, talks to us about the prevalence of glaucoma in this community.
Glaucoma it has a very high burden of disease in our patient population. Worldwide, it's the leading cause of irreversible blindness, and that's a scary thought. It's something that makes patients blind that we can't actually fix. So in terms of that is the reason we need to identify it early and treat it early. In our population here in South Africa, and certainly here at St. John Eye Hospital, it's an incredibly high burden of disease that we have. It occurs in a very large subset of our population. And the thing about glaucoma in our Black South African population is that it typically occurs in a younger subset of patients. And the glaucoma we're seeing is incredibly aggressive, meaning that it is very destructive to sight. And for that reason, we need to identify early and treat aggressively.
Andeveri describes the most common symptoms that glaucoma patients at St. John's Eye Hospital present.
One of the largest problems with glaucoma, and why we often see patients presenting quite late with their disease, is that it's known as the silent blindness, in that there's not many symptoms, or they are very subtle in the beginning. So it's a very slow decline in vision, so it's a progressive visual loss. So what patients may identify is that when they're driving, they have certain visual field defects, so they can't see in the periphery of their vision, because glaucoma will typically damage the nerve from the outside. So that's one thing they may present with. The thing about glaucoma is it's often picked up on routine screening. So someone will go for a glasses test and it'll be found that they either have a high pressure inside their eye or their vision is suboptimal. And when you do more investigations, you find that patients have glaucoma. So I think that's the main thing about Glaucoma Awareness Week. It's to get people to screen early, to get your eyes checked, because a lot of us may not even know we have glaucoma.
As we get older, our eyes do too. Andeveri talks to us about the ages and genders of glaucoma patients that they diagnose and treat.
We typically see a Black population here at St. John, and as I said, glaucoma is incredibly prevalent in Black South African population. So also in terms of gender, in terms of primary open-angle glaucoma, which is the most common type we do see, there's no gender predilection too. So really, it's a very varied disease that we're fighting, for multiple ages and our genders too.
What treatment options are available for glaucoma patients seen at St. John's Eye Hospital?
So there's a wide variety of treatment options available for glaucoma. We start with typically medical management, and that is quite simply drops the patients put into their eyes. And that's because glaucoma typically, not all the time, but typically patients have a high pressure inside the eye. And it's that high pressure that over time damages the nerve. So by giving patients drops, we try and lower that intraocular pressure. So that's the first arm of management. But the great thing about glaucoma is that in recent years, we've had incredible advancements in the treatments we have. So from medical therapy, we can move to laser therapy to try and increase outflow of fluid from the eye. And then we move to the surgical options. And that's really exciting because we have a whole host of surgical procedures we do, most of which we do right here at St. John, that include filtration surgery and also devices. We have a lot of devices and tubes and shunts and all sorts of fun things we can use. So we've got a lot available to us in terms of treatment and a lot in the armamentarium of the ophthalmic surgeon for glaucoma. It's just that we need to identify patients early, because the earlier we treat them with all these different options, the better their outcomes will be.
It is estimated that approximately 50% of glaucoma cases are undiagnosed. While it is true that the disease is incurable, it's also true that 90% of blindness caused by glaucoma could be prevented by early detection as well as treatment. Optometrist Audience Malulega and ophthalmologist Dr. Tebogo Malega join us in our discussion around glaucoma today. Good day, gentlemen. Nice to have you.
Nice to be here.
Good.
Day.
So let's jump into it. We're speaking about glaucoma, but a lot of the time we've heard people say this term, but it doesn't necessarily mean that people generally understand what glaucoma actually is. So let's start with you. Doc, what is glaucoma?
Glaucoma is a group of eye disorders that can result in blindness. They typically defined by the damage of the optic nerve, with the resultant loss in visual field and ultimately loss in vision. And you ultimately end up with blindness. It's the second commonest cause of blindness. And it needs to be screened for and treated early.
So, Dr. Malulega, the big thing here, and I think this is one that you'd probably see a lot of, are people coming to you with vision loss. And it's always let me go see an optometrist about this because or this and that may be happening. So how does it work, and what is the common presentation of people that come see you that you end up diagnosing with glaucoma?
During these routine eye examinations, patients would tell us that they have either lost sight from outward inward visual fields, as Dr. Mega has already spoken about that, as well that they would have like aching pain due to the raised intraocular pressure. Within the eyes.
What kind of pain is that? Is this a pain that's in the eye, or is this a pain around the face?
In the eye, the aching pain, some sort of blunt aching pain that you'd feel. Sometimes like pinprick kind of a pain can be characteristic of increased intraocular pressure. So they present with that, and then we would take them through levels of examinations, and then come to a decision or diagnosis as to where we are with their condition.
So you've spoken to a spectrum, this glaucoma thing, that, it is a disease of the optic nerve, but where can you find yourself along that spectrum? Do you get very mild cases where you won't necessarily know that you've got a problem and it stays the same for your whole life, where it doesn't progress, or do you find yourself, progressing along the spectrum to the near end of it?
Yeah, it's from mild, where the vision is perfectly normal, you feel nothing. There's not even symptoms that the audience is talking about. So in the mild stages of glaucoma, you actually feel nothing. You could be perfectly normal. And that's where the vast majority of patients are, where vision is perfectly normal. They come in for other complaints, eye complaints, and during the screening, during the examination of the other condition, we find that the optic nerve is abnormal or the pressure is abnormal. And this goes all the way to where patients are symptomatic, where they cannot see. And as a result of that, that's where we purposefully examine them. And they will come in with visual field loss, or they come in with blurry, poor vision. But by that stage, when you notice that your vision is affected, it's actually when the glaucoma is advanced. So by the time you have symptoms, it's normally the glaucoma is serious. So it's a spectrum.
Now, a lot of people, will speak to diseases of the eye or an inability to see or, progressive vision loss as a disease of older people, that I sing him dala, I can't see, and any of those sorts of things. Mr. Malega, the issue around who gets glaucoma, is it a young people's disease, an old people's disease, or just across the spectrum?
In general, it is common in persons over the age of 60, but that does not necessarily say that young people cannot be affected by glaucoma. We have a lot of young patients that are sufferers of glaucoma for many reasons, and I'm sure if you look at the insert that you played earlier, the young man is affected by glaucoma, and it's impacting on his quality of life.
So, what causes glaucoma? I mean, it's nice to know that, we know that there's an eye, there are nerves that run into it, but what causes it?
There's different types of glaucoma. There's one where the angle, which is the drainage channels of the eye, are. There's angle open glaucoma, and there's a type of glaucoma where the angle is closed. And the most common type of glaucoma is where the pressure is high, so high pressure glaucoma. Now there's a small subsegment, 5-10% of patients that will present with normal tension glaucoma, basically normal pressure glaucoma. So that's the commonest factor that we would, or type of glaucoma that we would say, or pressure is what we would say causes glaucoma. But there's, it tends to run in families, so there's some genetic involvement. There's actually the most studied gene would be the MyoC gene that regulates the myocilin in that angle where the drainage channels are. And defects in this gene result with clogging up of the angle and resulting in an imbalance in terms of excretion or escape of the aqueous, which is the fluid produced by the eye. So it can't escape freely, and that results in the pressure building up in the eye and resulting in glaucoma.
So when someone presents with this idea of increased pressure, I wouldn't know if I've got increased pressure in my eye or not. How do you diagnose that?
So usually in routine examination, as Dr. Marga has indicated, a lot of times patients will not have known that they have raised intraocular pressure because symptoms actually present later in the when the disease has already progressed. So we have various machines to take measurements that are going to be indicative to us as to whether this level of pressure is normal or is above normal. So there is a range that is actually acceptable as being normal, borderline, and actually high. Yeah.
Okay. With regards to this diagnosis that's been made, a lot of the time people that have glaucoma found themselves to have been diagnosed with glaucoma are people that didn't necessarily know they had symptoms before. Now, we've addressed causes being, primary eye things that you could have, but could there be something that you're doing, food, diets, non-exercise, or another disease that you have in your body that could cause glaucoma? Dr. Malik?
Yeah, there could be glaucoma, specific glaucoma causing things that you doing, and there's actually other things that when you have glaucoma, they make glaucoma progress quite rapidly. Causes of glaucoma could be things like medication. If you are on sulfur-based antibiotics, for example, if you are using steroids, can increase intraocular pressure. And you could have factors that make glaucoma progress quite rapidly. And these would be, vascular risk factors, so things that bad for your heart and heart conditions, things like smoking, if you have high blood pressure, diabetes, those kind of things will make your glaucoma progress quite rapidly as well. And then in terms of food, I would say food that's high in, in fat can result in glaucoma. But the one big risk factor is actually smoking. And if you are smoking and you have glaucoma or you have other risk factors for glaucoma, you tend to develop glaucoma and it tends to progress quite rapidly as well.
Mm-hmm. Now, we're going to head to screening a little bit later on in the show, about things that we can do to make sure that, we're finding out what the issue is before it gets to that point. But one of the big things around glaucoma is this issue of it being asymptomatic, that you don't know you've got this issue until it's progressed to a certain point. Do these sort of things and things such as glaucoma get misdiagnosed as something else? So a patient coming in, or going to a shop actually and buying glasses saying, they've got vision problems, so they buy themselves those non-prescribed glasses, then they wear them and it makes things better. Are there things that make things easier or better that could mask a glaucoma?
Yeah, of course. Like we said, a lot of times, glaucoma is picked up when it has progressed way beyond, or they've progressed such that the disease has already manifested in the patient. So it is important to teach and encourage the public that self-medication or self-treating is not the best thing that they should be doing. They do need to seek help, such as screenings, and these screenings can be done safely in the health facilities, be it in hospitals and private sector, where there is eye care services. When I talk about the hospitals, yes. Yeah, because not every health facility has eye care services.
For sure.
Yeah, so it is important that we got onto the habit of regular screenings or examinations, not only eye examinations, but health
examination
checks.
Throughout, for sure. All right, we've got Enoch from Witbank, if I'm not mistaken. Enoch, good day. Enoch?
Hello.
Yeah, but Enoch, please listen to us on the phone and not through the TV. Yes, please listen to us on the phone, not the TV, okay?
Okay, I'm listening, boss.
Yeah, but Baba, so what's the question?
Yeah, I've got a kid, he's 10 years, he's going to make 11 on the August.
Okay, what's the problem? Yeah?
The kid is scratching the eyes. When it comes to school every day, he's got a problem of scratching the eyes. I don't know what is the problem.
All right, we'll ask.
He said the eyes are itchy.
Is there anything that's coming out the eyes, anything that, discharges or things such as that?
Nothing comes out.
Nothing comes out, they just scratch?
Sure. Just it is always maybe sometimes.
Okay, we seem to have a bad connection with Enoch there, but I think we got the gist of his question. Dr. Malega, the issue of rubbing eyes, we'll all wake up in the morning and rub our eyes a little bit, but it's obviously pathological if it's continuing throughout the day. Is this something to be, worrisome about?
It's yes and no. One, the commonest cause of itchy eyes is eye allergies, and they're very common in that age group. I think he says it's a 10-year-old. And I think the child has allergies. Most allergies are mild, but if they are quite severe, then, if a child has to be rubbing the whole day, it's rubbing eyes is actually the physical act of rubbing eyes. It's not good for eyes because there's another condition, keratoconus, which develops mainly from rubbing your eyes, and that can change the curvature of your eye, and as a result get permanent visual disorders like keratoconus. So I think it's allergy that he's talking about, and needs to go in see an optometrist or an ophthalmologist to get prescriptions for prescription drops for allergy.
For sure. Thank you for that one, Dr. Malega. We're going to continue our conversation, and I hope that Enoch takes that advice. And it's always important to go out and go get assessed, and then the decision and the diagnosis is made at that point in time. Going for a quick ad break. We'll see you when we come back. Glaucoma is a disease of the optic nerve characterized by a loss of vision secondary to the eye issues that you may have and, of course, the increased pressure that you have in the eye. Of course, as discussed, there are many causes that could contribute to this, and that glaucoma is actually a spectrum, but is also known as the silent thief of sight. Because it is often not symptoms that are very obvious to normal people, there are many people that go undiagnosed, like many, such as Nimrod Sibandla, who's a glaucoma patient, and it sneaked up on him, impacting his peripheral vision, and he didn't even realize until he experienced severe vision loss. Take a look.
Nimrod Sibila never thought that what was a minor irritation with his eyes would lead to his diagnosis with glaucoma.
In 2008, when I started working with a computer, I found out that my eyes were itching every time before I go to bed. When I close my eyes, they started itching. And then I went to the doctor and checked to check where that. So the doctor said to me, I must use spectacles. I mustn't use naked eyes on the computer, because I sit on the computer for something like about 8 hours a day. So it's that strain that I get in the eyes. And then I used the spectacles for about 5 years, 5 to 8 years. And then in around 2013, he diagnosed me with glaucoma.
Vision impairment may run in the family, but was it the case with Sibila?
He asked me if was there any person in my family that was blind. I told the doctor that yes, on my mother's side, my grandfather, my uncles, at the age of around 60, they were getting blind.
How did glaucoma impact Sibila's life?
I can say quite a lot, because like now, I can't read, I can't drive. For example, I've got a driver's license which is expiring in about 3 years' time. For the past 2 years, I haven't touched the wheel, because I started experiencing that I can't see the dashboard and things. I wouldn't measure the distance. How far is the thing in front of me?
Sibila says that his treatment journey with glaucoma has been long and difficult.
The doctors have done about 6 or 7 operations just to delay the blindness. The doctors, what they told me is that when I asked them, how are these operations helping, because I don't see, they said, no, we are delaying the blindness. Because glaucoma, you are definitely going to be blind.
Sibila encourages people to start screening as early as possible.
I would advise people, it's important to check your eyes. At least minimal, maybe once a year.
Today, we've gone out and highlighted 2 case studies to you that you can see that glaucoma does not just affect older people, but also younger people too, as you've seen in what we've shown you. We continue our discussion, and one of the things that's been highlighted by our guests today is this big issue of screening. What does screening entail? Let's start with you, Malik. What does screening mean?
It means that we are trying to ascertain, find out whether or not there are certain things that we are we're trying to find out if at all there is something that may be hidden that we have not come across as a person. So when you do the screening, it will be able to reveal that now you have a clean bill, or there are certain issues that we need to be mindful of and take action or intervention to make sure that there is no progression of whatever the condition that we may be finding out. It's basically some sort of an examination or a checkup.
So, I mean, there's obviously a difference with respect to the levels of screening that we've spoken about. And I think you highlighted it earlier on, where you say there are facilities, for instance, that will offer very basic screening tools to assess whether you've got vision loss or may have issues. But then that goes across the spectrum to the high end, where you'd have to go to a facility that will do all kinds of tests to search and look for certain things in screening. In screening for glaucoma, are there specific things that need to be done to assess and make sure that you either have glaucoma or not?
95% of glaucoma is from high pressure. So that's the first thing that we do. The other thing is glaucoma is high pressure with nerve damage. So we have different machines, pieces of equipment, very sophisticated, that look at the nerve to see if there's any damage on the optic nerve. And following that, if there's damage on the nerve, there's high pressure, or even if there's no high pressure, but there's other risk factors that the patient has, either family history or so forth, then we would do other tests that will try and pick up confounding factors to having glaucoma. These are like measuring the cornea, the thickness of the cornea. People with thin cornea tend to have glaucoma more often, and it tends to be more aggressive. We would look at the angle, the drainage angle, to look and check if it's closing, or if there's any, I'll call it debris, if there's any fibrin material, pigment material on the angle that can cause clogging up of the angle and increase pressure. Then we would do other tests looking at the nerve itself. So in the past, we used to rely heavily on looking at the nerve itself and trying to, with the naked eye, spot if there's any evidence of damage, notching, the change in blood vessels. Looking at the retina, there will be areas where there's loss of nerve fibers. So we would look, spend quite a bit of time looking at the nerve, trying to look for all those factors. But now there are sophisticated tests, machines that within 2-3 seconds, they can give you more information about the nerve than you can actually
see,
process and see with your naked eye. And that's what in today's medical practice we would rely heavily on. So there's laser photography machines that will look at the nerve and actually give you values that you can follow up the patient with over time. And apart from that, there's I would stop there. There's other more invasive treatments or investigations that we can do, but we don't do those routinely. Routinely, it's just pressure, looking at the angle, looking at the nerve and retina for damage.
And you can only get to that after you've gone in for screening. I mean, it's not something that, you can walk past Dr. Maleka on the street and say, can you check my eye quickly? You need to be seen. All right, we've got Irene on the line. Irene, good day. Hello, Irene.
Hello.
Hi, Irene. What's your question?
Hello. Hello.
Irene?
Hello.
Hi, yes. Please listen to us on the phone and not on the TV, okay, Irene?
All right, I'm listening.
Right. What is your question this morning?
Question is that problem it has a bright like before. More especially I keep some like reading, it's getting like I cannot see a person from coming far so that I can see clearly.
Is this only when you're looking at the sun? All the
Even
time?
when I'm reading or watching TV, like before.
Okay, thank you for that. We'll get your question answered, okay?
All right.
All right, Mr. Malega, the issue of visual haziness, itching, scratching, and an inability to see. So, you know, when she says she's reading and things such as that, what may be the cause of her having these symptoms?
There is a possibility that we have a refractive error. As she says that she is not able to recognize things at a distance, including even when reading. So I think largely it's the whole issue of refractive error. And if she was to visit an optometrist or a healthcare practitioner, eye care practitioner, would be able to assess, do a full comprehensive examination to help with that refractive error and also exclude other
For sure.
other issues because there is haziness and all of that. So haziness is also another of the issues that we need to be in the lookout for as a potential problem.
For sure. All right, we've got Mike on the line as well. Mike, good day.
Good day, good day.
Yes, we're listening. What's your question?
I just want to know, I was diagnosed 2 years ago with glaucoma. How long is the process before a person goes totally blind?
All right, so an interesting and very good question. Thank you for that one, Mike. The issue of going blind, I think we've spoken to this idea of it being a progressive disease, so you may end up being blind. But is there a process where if you've been diagnosed with glaucoma, you will be blind, or is there stuff that can happen along the way to stop that progression?
There is stuff that can happen to stop the progression. Once it's diagnosed, you don't really have to go blind. Over 90% of blindness in glaucoma can be prevented once diagnosed. Yes, there are some aggressive forms of glaucoma that, despite all manners of treatment and surgeries, you tend to progress and, you know, the pressure continues to be out of control. Some surgeries might work in the beginning and end up failing. So yes, you can end up being blind, but untreated, if you have a pressure in the 20s, normal pressure is 21 and below, 20 and below. If you have a pressure of between 20 and 30 millimeters of mercury, it can take about 15 years, 20 years for you to go blind. With pressures higher than 30, let's say 30 to 40, 5 to 10 years, you could be blind.
Sure.
And unfortunately, there are some people that run 40, 50, 60 millimeters of mercury pressures, and those within 2 years, 3 years, the sight will be gone. Yeah.
So look, I think it's one of those things that you highlight is that a lot of people get a diagnosis and then think that's the end of it and never want to follow up for treatment or chase treatment thereafter, which is obviously a problem. And I think with the numbers that Dr. Maleka has highlighted to you, is that if you are diagnosed with glaucoma, sometimes you don't know what kind of glaucoma you've been diagnosed with. So sitting at home and avoiding visiting a healthcare provider for this may actually lead you to becoming blinder much quicker. We've got another call on the line. Good morning.
Morning, it's Lorraine speaking. I just need to find out, for screening, which doctor must I consult, the ophthalmologist or the optometrist?
All right, so it's an interesting one because they're both here, so we'll hear what they have to say. Mr. Malek, who do you go to when you initially think that you want to go for screening for your eyes? Should they come to an optometrist, an ophthalmologist? Who do they visit?
Makes no difference, doesn't matter.
Okay.
All of us are capable of doing the screenings, and we work as a team that co-manage if there are problems. So it is important to indicate that, yeah, of course, it may be difficult to actually see an ophthalmologist as easily and readily as compared to optometrists due to largely the numbers, the number of practitioners available and all of that. And, optometrists are available at the primary level, and ophthalmologists are specialists, but they will not turn you away if you have had access to them.
For sure.
Yeah, so it doesn't matter who you have contact with and are able to go and see. We'll all be able to...
As long as you're seeing someone.
Yeah.
As long as you're seeing someone. All right, good. After the ad break, we'll continue our discussion with optometrist Audience Maluleke, as well as ophthalmologist Dr. Tebogo Maleka about screening, as well as looking at the treatment. Welcome back to Vital Signs. Now, the main objective of treatment in glaucoma is to maintain vision and quality of life for the patient. Treatment is currently aimed at treating the cause in secondary glaucomas and all types of glaucoma by reducing the eye pressure. We continue our discussion with optometrist Audience Maluleke, as well as ophthalmologist Dr. Tebogo Maleka. So we've spoken about diagnosis, we've spoken about screening and why it's so important to go out and screen, but I think we also need to look at the sort of treatment modalities that exist to assist people that have been diagnosed with glaucoma. What are the most popular and most common ways in which you treat the common glaucomas?
90% of glaucoma patients are on drops. So once, and the aim of treatment, or the measure of success in terms of treating patients, is lowering the intraocular pressure, lowering the pressure inside the eye. To certainly below 20, and in patients that have advanced glaucoma, we might even aim for pressures in and around 16 and below. So the first modality is drops. We normally start with 1 drop and review a patient in about 2-3 months time to see if the drops have worked. And if the pressure is unsatisfactory, we might opt to either swap for a different agent of drops, or we add a second agent, so to have 2 agents lowering the pressure in a patient. And if that doesn't work, we either put the patient on a 3rd agent, or we go for surgery. And in terms of surgery to control eye pressure, there's different types. So there's little stents that we can put inside the eye to help with the outflow of aqueous, of the water from inside the eye. Or we can progress to surgery called trabeculectomy. This opens a little window. You make a little window under the skin of the eye to help with the escape of aqueous from inside the eye. And there are patients that have more aggressive types of glaucomas, and that's where we would go for these bigger shunts. We call them shunts. It's bigger valves that drain a bit more aqueous than the tiny little stents that we commonly use. And these are, yes, for aggressive types of glaucoma, or if the stents and trabeculectomy have not worked in that patient to lower the pressure enough, then those shunts are used. But the aim is generally to lower the intraocular pressure.
Is this lifelong treatment, or is this something that will manage my glaucoma for now and things will get better?
I would say it's lifelong treatment. Once you're on drops for glaucoma, you need to be on drops indefinitely. And the main area of focus, once you've been treated, once you've had surgery, once you're on drops, is the follow-up. So we look at the visual fields, which are commonly affected in glaucoma. So we do serial visual fields. You might have that done twice every year, or at least once every year, just to see that the field is stable and you don't continue to lose the visual field. And we do these scans that we do for diagnosing. They can be used for follow-up. And these sophisticated scans have software that will compare the old scans to the new ones, just to see if you have progression of the optic nerve damage. And the aim is to stabilize that. We want the scans to be the same every year you come through. And then we know that your glaucoma is controlled.
Controlled and stable. All right, we've got a caller on the line. Yolisa from Cape Town. Good day, Yolisa. Hi, Yolisa. Please listen to us on the phone and not the TV, ne?
Okay.
All right, so what's your question this morning?
My question is, my dad is 87 years old of age, and he was also diagnosed with that glaucoma. But the problem is the doctors, I took him to the doctor, and the doctor said he is very old to do other operational stuff. So I would like to know, what can I do to get him some help? Because they made him some glasses, but he can't see, even though he's using the glasses. And he went to Makiwana for several times, but they're not doing anything. They keep on giving him some drops and stuff, but after he using that, he's getting worse.
Okay, thank you for that question. The issue of drops and treatment, I think you've highlighted that they're the mainstay of someone that would have a very typical glaucoma, and the aim is to decrease the pressures in the eye. Is there an additive that people generally do on top of giving the drops, like adding spectacles to help the person see better? Will the spectacles assist with the glaucoma? Let me ask you, Mr. Malek.
If glaucoma has progressed to the level that the nerve damage is excessive, not even spectacles will help with restoring that vision. Remember, with glaucoma, that the nerve damage, we cannot reverse it. We can't move back. We can't go back. Once it's damaged, it's damaged.
Okay.
That's why the aim is to, as Dr. America has said, the aim is to make sure that the stability within your nerves, because if or once the damage has happened, you cannot bring back the vision. We can only maintain what we have. But as I said earlier, that there are some aggressive types that may not necessarily respond to treatment, the drops, at which point other alternatives may need to be taken into consideration, such as surgery. And I think can elaborate a little bit more on that.
So at age 87, patients tend to have cataract. And when you go in for cataract surgery by itself can reduce the intraocular pressure by about 15% or so. So it's additive in terms of helping.
Okay.
And the only thing that I can think of at 87 is why the doctors do not really want to act at that age is that the vision might be, or the damage might just be so severe that there won't be. You find that some people have very, very, very little vision. It's just they can only tell whether the lights are on and off. And on the cost benefit calculation, doctors might decide it's not worth operating on this patient, and maybe give somebody with iliac glaucoma, milder vision loss, an opportunity to be on the theatre list as compared to somebody that's 87
for sure
with severe vision loss.
Yeah, that makes sense. I mean, I think it also something that must be considered is maybe the person's got many other issues that they're currently dealing with, and then that cost-benefit analysis comes into play. Well, gentlemen, thank you so much for joining us today and really sitting down with us and breaking down what glaucoma is, what it means, the importance of screening, and of course the treatment options available to anyone that is diagnosed with glaucoma. It is so important to step out because this is a disease that sometimes lives asymptomatically. So if you can and have the opportunity to go out and get screening, whether private or public, wherever wherever you may want to go to get the help that you want to get out there and get that screening done so that any issue is picked up early and you can get the assistance that you need very early on. And of course, thank you to our guests for coming in today, and all of you participating, coming in and giving us your calls. Thank you so much for that as well. We will see you again in the following week. We'll be discussing something else that impacts on your life as well as your health. From me, Dr. Musa Mtombeni. Till next time.